Welcome to the Vitality Vault Podcast, your one-stop shop for health and wellness. Join us as we dive deep into the latest medical trends, break down complex health topics, and empower you to live a more vibrant life.
Hi there. I'm Dr. Bacchus Morris, a triple board certified physician who specializes in internal medicine, obesity medicine, as well as anti-aging, regenerative, and aesthetic medicine.
Hi, I'm Dr. Gerald Morris, and I am a double board certified physician in internal medicine and obesity medicine with special interest in peptide therapeutics, which I got certified in.
Together, we're passionate about helping you achieve optimal health and longevity. From exercise, nutrition, we'll be bringing you the latest cutting edge in terms of weight loss and everything else in the wellness world to help you achieve a healthier you.
So our goal is to help you live your best life. So whether you're looking for weight loss strategies, longevity, just want to live a little bit better, and have these tips that you can apply to your daily life from day one, we are here to help. So come join us on this journey.
Join the doctors, voted top internist in Tucson 4 years running. So let's unlock your potential together. Welcome to the Vitality Vault Podcast with Dr. B and Dr. G.
Hey, what's up, fam? Dr. G here with the lovely Dr. B with another installment of AMG Vitality Vault. Dr. B, how you doing?
I am doing well today, thank you.
God, I haven't seen you in a minute, literally. I feel like I haven't seen you so long. It's just been one of those years, right? We're just rolling in day after day.
Right? It's February already.
And it just feels so stressful sometimes. So, so this is why, I like my socks, right? So I picked today Bart Simpson. Who doesn't love The Simpsons, right? Oh. And why did I pick Bart Simpson? Because if you notice from my socks, right? Look at him. He's spazzing out. And like most people like him, they create stress.
Oh, yes.
So I picked him for this particular talk because we're going to be talking about cortisol and stress.
Absolutely. Today we're talking about that stress hormone,
yes,
cortisol, and how it can possibly wreck your health and what to do about it, of course. We're going to give you some tips and just educate you a little bit on what cortisol is, what levels mean, and how to get those levels under control.
All right. So let's start. Cortisol and stress. So what exactly is cortisol? Now, we all know, everyone's heard the word cortisol. Mm-hmm. It's a stress hormone. It's created by your adrenal glands in response to something, honestly, upsetting or pissing your body off, whether it's emotional or actual physical or health-wise.
And we all need cortisol because it does have its benefits and its functions in the body. So you can see here that it helps to regulate metabolism. So there's certain mechanisms of metabolism that it powers.
Yes.
It helps to maintain immune function. So proper levels does help with your immunity. And stress response, it is a stress hormone. It goes up in response to stress. It's supposed to do that, but it's through its different mechanisms that it helps you. So short-term cortisol elevation or release is definitely beneficial to your body because of what we just spoke about. But chronic elevation is something that we don't like seeing because it can cause added health problems and cause havoc on the rest of your body.
Yeah, and we're going to focus more on the more common stress reactions that we see. We do know that there are some pretty significant diseases that we treat as physicians that are because of hypercortisolism, which is too much cortisol. And one of the major ones that we see, thankfully not too often, is like Cushing syndrome. So that's one that, we're not going to touch on that one too much, but It is a pretty serious disease of hypercortisolism, which is something that we look at, and there's medications used for that. But
it's not caused by stress, but that, so what you're saying is we're focusing on the stress,
exactly,
on the effect of stress and causing that elevation of chronic elevation of cortisol. But yes, there are some other medical conditions that can cause it, not because of stress, but because of other processes going on in the body.
Inflammation, typically inflammation, anything to upset the adrenal glands can cause problems. All right, so here's some signs of chronic stress, right? And who hasn't experienced at least one or two of these in their life, especially living on Earth? That's why I'm moving to Mars soon. Giving you a
We
heads
all
up.
should.
Yes. So persistent fatigue, just kind of that brain fog feeling where, you can't really focus. Weight gain's a big one. Weight gain is a
Absolutely.
big one, which we treat all the time for different reasons, but stress can definitely lead to weight gain. Mood issues, difficulty with focusing, like I said, abnormal sleep. You can definitely see poor sleep patterns because of chronic stress, which are due to elevated cortisol levels. Right? And of course, when you have high cortisol levels in your body, guess what happens? Your immune system breaks down. When that happens, issues like whether it be viruses or even infections, bacterial infections or UTIs, all those things come into play or become more frequent when that happens. A big one is people who have cold sores, or which is a herpes labialis on the lips. Obviously, that's a big one caused by stress.
So cortisol reminds me of a hormone that we spoke about before on the podcast, thyroid hormone.
True.
Right? Because normal range of thyroid hormone is needed, just like cortisol, for metabolism and other functions.
Yeah.
But too high can be a problem, and too low can also be an issue as well too. So you kind of see a pattern in these hormones that are vital to the body, but when they're out of range for too long, they can create problems. So yes, let's take a look at what we can do, or what cortisol causes when it's being elevated chronically. So definitely puts you at risk for weight gain and obesity. It elevates your blood sugars.
Yes,
so people with elevated cortisol for a long time can actually develop diabetes, unfortunately. And with this elevation in inflammation, it can lead to other chronic conditions like heart disease, other chronic inflammation, joint issues as well too. Hormonal imbalances. So we just spoke about other hormones like the thyroid, but it also interacts with others like your sex hormones, testosterone, estrogen levels, etc. So it can cause imbalance of those hormones even.
So it's important to note that all these hormonal systems are linked. You can never and you shouldn't really just be treating one. If a patient or if someone is coming to you, you want to look at the entire picture. Right. You may find one thing, but always be on the lookout for others. Like I say to my patients, a lot of these disorders run in packs. Sometimes one wolf shows up, but don't be surprised if the rest of the pack comes up, if not months or years down the line. So you should always be vigilant to make sure that you put that wolf out real quick before other ones show up. And we talked about the weakened immune system already. That's one big one we can see. And then aging. Stress will age you. It'll definitely age you. Absolutely. It affects your brain function. It's something that, you see some people sometimes, and people always ask you, why you look so tired. And it could be the fact that you're just really stressed. And stress, poor sleep, all those things will just advance your age physically than you really want. And
advance your brain age. That's a big one.
Yeah.
Memory fog sets in, difficulty remembering certain things, concentration. And then it's a vicious cycle because of that, you're not sleeping well, you develop more anxiety, and then it causes more neurodysfunction.
And the good thing is, if you're a husband, you're good because your brain age stops at 8. So I'm golden. I'm golden. Your brain age just stops.
No comment.
Exactly. Comment, no, none here.
All right. So you don't know anyone with stress around us, do you?
Of course not.
Of course not.
Stress. That's a made-up construct.
Right. So stress is all around us, guys. So what can we do to help to manage that cortisol, getting out of range? What can we do to prevent that? Because we know we're going to be faced with stress. We know on a daily basis, whether it be family, external forces that we can't control, we are going to be faced with stress. So one big one is prioritize sleep. So you got to make sure, we've talked about sleep hygiene before, going to bed at a certain time, avoided certain like blue light and, just screen time, et cetera, avoiding that before sleep. And, doing different things to help with deep restorative sleep, whether it be, taking like a melatonin supplement, having something wearable, like I have my Whoop today, that's going to help you with tracking your sleep and helping you figure out what what do I do before sleep that helps me to get more in my REM sleep, more restful sleep. So sleep is a big one when it comes to stress and cortisol levels.
I think sleep is a huge topic on its own, which I know we're going to tackle in one of these episodes because it's a big one.
It is.
So you
huge.
mentioned a couple of things you can do to mitigate sleep issues. So I struggle with that myself. So I do get decent enough sleep, but I'm an early riser, and you can ask Dr. B. It's just upsets her sometimes because I am literally up at like 3:30 in the morning or 4 o'clock. My eyes fly open, and I'm ready to go. The flip side is we don't always get to bed early enough because guess what? We got kids and we got obligations, patients calling at night. So I tend to get about 5 to 6 hours of sleep. I'm pushing for 7 to 8, which I have gotten sometimes, but it's not sustainable.
Great, right?
It feels great,
Yep.
but it's not sustainable. So things that I know I do is I try to develop a wind down routine at night where at least an hour before bed, TV off, just have some light music playing. I know a couple of the hacks that people do for sleep is getting red lights in the house. So you get rid of the blue lights or the screens, like the LED screens from your phone, or even on your phone. If you're a phone person, put it on night mode because I think that the phone, it changes the hue of the phone. So that way, getting that constant blue light that's messing with your pineal gland, which messes with your sleep. These are things.
There's also blue light blocking
Glasses,
technology in glasses. Even if you don't wear prescription glasses, you get blue light blocking ones.
And obviously avoiding a lot of alcohol before sleep, but we don't drink. But if you do, avoiding that nightcap situation, because guess what? It disrupts your REM and deep sleep. You don't really go into that restorative sleep, and your brain doesn't get to drain some of that gunk it developed throughout the day. So it's important to do that.
All right. Well, we have some things up on the slide to avoid. So reducing your overall caffeine intake.
Not doing that.
You do caffeine to help with energy, but caffeine does spike your cortisol levels as well too. Sugar. Oh my goodness. Sugar. Processed sugar is a bad one. I mean, we know it for so many different reasons, and here as well for cortisol, it's a no-no.
So what about natural sugar?
You can have it in moderate amounts.
Okay.
You're talking about sugars from fruits and,
like fructose, because, people would say, well, you know what? I just love my bowl of grapes or a big bowl of cherries.
Again, you got to look at how much sugar you're eating in that bowl. And certain fruits have different amounts and types of sugars. So especially like your tropical fruits, especially like when they're very sweet.
I was going to quiz you. I was going to say, which family of fruits typically are the most insidious to have the highest tropical fruits? I know where we're
everyone
from.
Loves them.
We love them. Where we're from, that's the bananas.
And when they're sweeter, those sugars are not the best. But if you had to choose between that and a candy bar or a cookie with processed sugar, then yes, definitely the fruits would be a better idea. But you have to have a balanced diet.
Yes.
All right, back to our slide here. Practice. Mindfulness and stress reduction practices. So we'll talk about a couple of them here. Meditation, any type of low impact exercise like yoga, Pilates, Tai Chi, those type of exercises that incorporate your breathing. And there's separate deep breathing exercises as well too that can help with decreasing your cortisol levels.
Yeah, really awesome. Now, you can also, if you still need help and you want to do something natural, something plant-based, we have adaptogens. What exactly is an adaptogen, Dr. B?
Well, adaptogens are typically botanical extracts or supplements that help your body to mitigate the effects of stress. Because unfortunately, there's nothing to prescribe to reduce your stress. Like stress is going to be there. One of these days we'll come up with something.
Yeah, move to Mars.
Right? Move to Mars is going to be what it is. But yes, your body's going to be faced with stress. So these are herbal supplements, typically that will help to reduce the effect of stress on your body by modulating your immune system, and and then in turn it helps to normalize or balance out your cortisol levels. And there's some well-known ones, such as ashwagandha.
That's a good one.
Rhodiola. There's holy basil. Saffron is one of them.
Saffron's a really good one.
You could also do like licorice. And there's a whole range, of Chinese herbs as well too that you could use.
L-theanine, a favorite of mine.
L-theanine is one of them.
DHHB, which is honocule. It's an extract from the bark
Yes.
of the, I think it's the magnolia plant.
Magnolia bark.
And that one actually is funny. There are some studies to show that the DHHB, which is the honocule extract, right? That one actually has some studies to show it has almost similar effects on stress and relaxation as taking a Valium without that issue of dependency on on Valium. So it's one to consider, look up on your own and see, and obviously these are examples we're giving, right? These are things that people use on the regular. We want you guys to be able to do your own research, talk to your doc and see if those fit in with what you're currently doing.
Right. And your other medications and supplements too. All right, I'll let you take this one, Dr. G. Exercise. It's your specialty.
That's right. Exercise, buns and thighs. So low impact, keep it light. What we mean is doing exercise at least 3 to 4 times a week. Low impact is good. Going for a walk, outdoors, guess what? You get to experience nature, and you get the heart beating and you get the blood flowing, you release the endorphins. It can get you feel better. If you're really stressed too, pick up a boxing class. That is fun. Because I know we can't hit some of the people we come across in the world because that's not cool. You go to jail, but you can hit a punching bag really hard. So, doing these things that kind of get the blood flowing, get you going, these are important to do. So exercise is a huge one.
Question and exercise. So you talk about low impact, right? Yeah. What about, I know people that love to do the high intensity exercises and they're in the gym every day doing that. I know you got something to say about that.
So why you gotta point at me? Why you gotta do that?
Oh, that was not my intent, but okay.
Okay, so what Dr. B is alluding to is overtraining. So if you're someone who is a gym rat, or like me, you love it because the gym is my therapy. I love it. You really need to give yourself rest in between. So you really should be doing, if it's vigorous activity, no more than 3 to 4 days a week, with at least a rest day in between 2 days. On average, is what you should be doing to allow the body time to heal and rest, because doing those exercises will raise your cortisol level and other stress hormones in the body, increase your CRP, and that's inflammation. And if that's done chronically, what you're going to find is over time, your rebound and recovery from training begins to dip. So it's like a law of diminishing returns. I'm working out more, but I'm not getting stronger. I'm actually weak. That's because your body's telling you, calm down, give me a break, let me recuperate. And that's important. And there are a lot of studies out there to show that high-intensity athletes who get viruses have a tougher time of recovery because of the potential, or they may be in an overtraining state when they get sick, because they overtrain and guess what? The virus decides to sneak in and now they're sick. So it's important. You want to do exercise, but be careful of overtraining, because that's a killer for your immune system. So
you got to sprinkle in that low impact exercise and recovery.
Yes, recovery is important
well too. Yes.
Yeah, that's cool. A quick tip for you guys. Guess what? If you do L-theanine is what I take. It does help to modulate your gamma delta T cells, and those cells help to defend your body against viruses. So look it up. See for yourself if it's something that you could take. I love L-theanine.
He does. Takes a whole cup full of it.
Oh, Lord of mercy. I take what's recommended by my physician, who happens to be me.
Sometimes he overtrained because he's a little zealous.
I take what's recommended by my physician.
He doesn't sleep the 7 to 9 hours, so a lot of recovery is included in your regular routine.
Listen, we always advocate. No. We advocate you need to take what's recommended by your doctor, correct? So I take what's recommended by your doctor. Yes. It just so happens I happen to be my own physician when it comes to these things.
You're being very Bart Simpson right now.
Wow.
So.
Thank you for that, Bart Simpson.
Yes.
All right, Dr. So that was cortisol and that was stress. Now, just a point, testing for cortisol. Typically, the regular test that we do is for those who actually have more of the Cushingoid or Cushing type diseases that really cause issues with that. When we're dealing with cortisol with regards to stressors in life, it's difficult to test for. One that we typically use is on the functional side, but we do like a cortisol level through our 24-hour period.
And it's salivary.
It's salivary. So it tracks exactly over the 24-hour period how your cortisol level spikes and comes down. And that can give us a lot of information as to where your body sits in the spectrum of a 24-hour period with regards to cortisol. So getting a regular random cortisol from your primary care doctor may not be beneficial to you.
Yeah.
Unless you have symptoms of Cushing syndrome, which are pretty typical, like high blood pressure, weight gain, stretch marks that are bright purple on the body. So there are some hallmarks of that disease. But if it's from stress,
if you're just not feeling right, like you have some of those symptoms we talked about, then you would want to ask for salivary hormone testing.
Yes, for cortisol.
Usually one that cortisol. Usually one that has about 4 different times during the day that you check. Usually first thing in the morning. And the last one will be just before bedtime, and then there's some times in between because cortisol does follow a specific pattern throughout the day. So we would want to look at that pattern and see what yours look like, and see if we're looking at a chronically elevated or kind of a burnout.
Yes.
People refer to that as adrenal fatigue. So that's what you want to ask for if you're suspecting that may be what's affecting you and causing you not to feel well.
And it's a test that not many physicians or primary care providers know about. So do your research. Find a functional doc who actually understands and is able to read those.
Awesome.
Dr. B, cortisol?
Yeah.
Stress? No more. Get good sleep. Don't drink. Live well.
Absolutely.
Bye, guys.
Bye.
Thank you for watching and listening to the Vitality Vault with Dr. B and Dr. G. Don't forget to check out our other informative episodes as the doctors dive deep into your health and wellness so you can live a more vibrant life.